On this week's episode of the Wellness Lounge, I'm continuing my conversation on infant and maternal mortality with Janice Smiley, the Director of Perinatal Health at the Alabama Department of Public Health. And later in the show, I will introduce this week's Daily Drop. It is a fascinating conversation you don't want to miss. So sit back, relax, and get ready for real talk in the Wellness Lounge.
Come meet best-selling author and integrative health and wellness expert, Dr. Tiffany Taft at MAC Author Spotlight, a free virtual book discussion on Saturday, October 10th at 10 a.m. via Zoom. Presented by the Montgomery Alumni Chapter of Delta Sigma Theta Sorority Incorporated. You'll hear from 5 local women authors whose books cover a range of topics. To register and receive your link to attend the event, just go to www.montgomeryalumni.org. That's the MAC Author Spotlight on Saturday, October 10th at 10 a.m. via Zoom.
I'm continuing my conversation on infant and maternal mortality with Janice Smiley, the Director of Perinatal Health at the Alabama Department of Public Health. I always like to educate my public with some statistics or the science, if I can, where appropriate, because I think it's important to know the numbers. And, you know, the numbers come and they're from a certain period of time and a certain viewpoint. But science is science. Mm-hmm. There is evidence in the science, and Alabama has not always fared well. And I did look at some numbers going back, I think, to 2016 up through 2018. Mm-hmm. And while we have improved in that space, we are still, I believe, number 3 in the nation of poor maternal and fetal mortality. Mm-hmm. So while there, yes, is some improvement, we're still not going in the right direction, but not as well as we should be. So Can you speak to any of those numbers and if you've seen any disparities amongst African-American community versus other people of color or our white counterparts? Have you noticed any challenges or disparities in that space?
Absolutely. When we talk about numbers for maternal health, we have data that we're trying to really come together and confirm. When we talk about maternal deaths, we know that we have about 60,000 births approximately a year, and 60% of those births are to white women, 30% are to Black women, and the other 10% make up the other races that are a part of our state. And so when we look at that, we look at our maternal mortality. And so the latest data that we have that has been confirmed is that there were 36 maternal deaths in 2016, and the racial disparity is somewhere 3 to 4, being that women of color died 3 to 4 times more frequently than white women. And then the counterpart to that is infants, because the mothers and babies go together. So when we look at our infant mortality, and that's these numbers we have been studying for years. And so we have more data that is confirmed, and I can talk a little bit more about that. For infants in 2018, which is the latest data that we have, our infant mortality rate is that 7.0 deaths per 1,000 live births here in the state, which is equivalent to 405 infant deaths. And when we look at that, there is a racial disparity there as well, because for every one white baby that is born that dies, there are two black babies. So there are racial disparities there. So what are the reasons why there are disparities? There are many, many factors many theories about there, but there are also, when you look at it, there are some glaring facts that just stare you in the face, and you just have to acknowledge they are what they are. And I was attending a webinar, I guess a couple of months ago, and he was saying, well, really, when we look at disparities and we really try and identify what they are, what the cause of the disparities, what are the causes of the disparities, and so we said racism really is the cause. When you looking at it, the only difference is that of race, then racism itself is the reason why we have these disparities. So when we look at disparities, again, talking about all those factors that impact the overall health, you look at communities in which you have that are predominantly Black communities. They don't have high-paying jobs. They don't have grocery stores. The education in those communities are not high rate or of high quality. If there are healthcare providers, having access to them and the quality access is limited if there are providers there within there. And so systemic racism continues to impact our outcomes as a people, and it just is what it is. And until we address that, I don't think we can really begin to identify what can be done as a state to make things better. So when we look at those contributing factors, the three leading causes of infant death here in the state of Alabama is birth defects, prematurity, SIDS, and we added a fourth one, so it ties SIDS and infections of the newborn, tied as the third leading cause of death for infants. So when you look at those, well, what about birth defects? How can you decrease or to eliminate birth defects? There are things, again, going back to that preconceptional period before the woman becomes pregnant, making sure you're getting that folic acid, making sure you're at the right weight before you become pregnant. Don't do drugs or alcohol or smoke. Know your family history. And if you have chronic diseases, manage those things. But you can do all of those right things and still have a bad outcome because of the system in which you live in. Yes. And sadly enough, there are statistics that say for women of color who are educated and have advanced degrees, such as master's degrees or higher, infant mortality rate is higher than a white counterpart who have not graduated from high school.
Yeah.
That speaks volumes.
And we see that with Serena Williams, I believe,
Yes.
and Beyonce, and a few others that are, well-known singers, superstars, athletes that, maybe they don't have, and I don't know if they have the advanced degrees, but they're certainly well-known, and women of means, women of color. And so there's no reason they have access to any kind of doctor or healthcare situation that they need, but then they found themselves in those very situations where fortunately their outcome was not death, but they certainly went through a very arduous process, health-wise, to make sure that they survived as well as their babies survived too.
Yes, and there's research out there that says for women of color, the providers don't listen and don't hear what we're saying. And this research was the impetus upon which the CDC has now started their campaign, Hear Her Speak. Yes. Because we have to be heard, we have to be understood, and we have to be taken serious. Our health is just as important as others' health.
We'll have more with Janice Smiley after the break. Well, so I am a health and wellness, I call it integrated health and wellness therapist. And so I utilize several different holistic tools in my practice. I'm also a birth and postpartum doula. And so I would be interested to know, does the state of Alabama embrace the concepts around the utilization of doulas and or midwives as alternatives or in conjunction with the traditional medical teams, the OB doctors? And have you seen, if you've had experiences with doulas and midwives, have you seen successful outcomes? Or what are the dynamics? Because we know doulas and midwives are coming from more of the holistic approach, but not everybody is necessarily comfortable. Although I'm pleasantly surprised at the number of people that are looking for alternatives to the traditional Western medicine that we all know. I would just be curious to know if your agency has been exposed to any experience around dealing with doulas, midwives, and the intersection of Western medicine.
Well, our agency um, no longer has maternal care, so we no longer provide maternity services as an agency. However, through our family planning clinics, we do have nurse practitioners that works with our medical officer for the Bureau of Family Health Services, who happens to be, by the way, practicing as an OBGYN in New York. So we definitely support nurse midwives. As far as doulas, that's something new here in Alabama, sort of. They didn't call them doulas. What they used to call them were the midwives and things of that nature. So Alabama, I think, has room to grow in this area of actually supporting nurse midwives, and as well as supporting doulas and understanding their role and how they can help to improve birth outcomes by coming alongside that mother and helping her through that pregnancy and even afterwards.
Mm-hmm. And I ask because specifically the role of the doula is this: she's that or he, because there are male doulas, right. The continuous support for mom before, during, and after delivery. She's a non-medical, so they are a non-medical support person. And then of course that midwife, I like to mention them because we have, granny midwives, we have those that now have gone through formal trainings. And I believe Alabama now has reintroduced, if you will, the certification of its midwives. There's a process now in place. They're on board. So with that, in closing, I would like to ask you just a few other things. One of which would be, if you had, and I think I saw this from one of your prior interviews, if you had $1 million, what would you do with that money?
If I had $1 million, what would I do? I think if I had $1 million, what I would do was I would inform those in decision-making positions of the importance of what they need to do to support the families here in the state of Alabama. Stop putting the blame on mothers and infants for their poor outcomes. If you don't have access to things that you need, how can you get them? I would not tell my 2-year-old to get up, go in the kitchen, and cook yourself dinner. That doesn't make sense. But as a mother, I would go in and I would cook dinner and set my 2-year-old down to make sure that my 2-year-old has the things to eat that are healthy and good for him or her. So giving that money to those, and not giving the money, but using the money to educate, to support, and to provide resources for those that need them, I think would be a way of, one, raising awareness and helping people to think differently, especially those who are in decision-making positions, and realizing, yes, we do need this, or we don't need that, or to consider what is needed, and to bring about the message to raise awareness, stop blaming the mother and the infant. The community plays a role as well. What can we do as a community to support, to provide the resources that our families need? And then I think the last thing I would do, and that $1 million sure wouldn't go would not go a long ways, because I think families also need support. When you think about the Nurse Family Partnership Program, I think that is a tremendous program, because just as that program provides a nurse to be with that mother up until 2 years of age, often that's just what families need, someone to help them to navigate the different streams that they need to interact with, so that they're going in the right way and they know to ask these questions, or to know to ask the right questions, or where to go to get this or where to go to get that, because navigating the system within itself sometimes can be challenging. And with the challenges that they're faced with and the attitudes of people that they're having to deal with to get access to the things that they need, can sometimes just make you feel like it's not even worth it. So going back to making sure those that are providing these services for the populations that need, that they really understand the population and understand the need. People don't want a handout. They really don't. They want to be able to make decisions and the ability to be able to have access to the things that they need where they work, live, and play, just like everybody else.
Mm-hmm. So I know Alabama has conferences that normally they do in person, but are having virtual summits this year. And that
Yes.
summit is called, let me look at my notes, Examining the Roots. And when you finish the title, and what is the purpose of that summit, and what can people expect that they would have taken away from that summit?
We're going to look at the fundamental foundation of infant and maternal health and what are the root causes of those things here in Alabama. We're going to have some providers that provide actual care for women and infants here in Alabama. They're going to talk about some of the things that they see day to day in their practice. And then we're going to look at the root causes of racism and how it impacts the outcomes, birth outcomes that we have. And then we're going to have some real live people who have experienced fetal deaths and infant deaths, as well as a sister who's going to talk about losing her sister after she had given birth. So just looking at being real about it and helping people to understand the root causes of fetal and infant mortality, as well as maternal mortality, and how maternal and infant mortality really can't be separated. They go hand in hand.
Yes. So along with your agency, are there other agencies that the people can reach out to if they have additional questions or need additional information around maternal fetal health, and how they maybe can get engaged, or at least have information that they can share with community?
Oh, yes, there are lots of agencies that are working with this. I'm just going to share a few of our partners. I talked about the Nurse Family Partnership. The Gift of Life Foundation is a foundation that has been in Montgomery for more than 30 years now, and that's what they do. They're about mamas and babies, improving their health and birth outcomes. And then we're also partnering with the Birmingham Healthy Start Plus. They too have been in place, I think, since the 1990s, and their focus is helping mothers and infants of lower income to navigate the system and to improve their birth and health outcomes. We work with the March of Dimes. We work with the American Academy of Pediatrics. We also work with the American College of Obstetricians and Gynecologists. We work with different agencies, state agencies, as well as community leaders and nonprofits, as well as profits. We work with the hospitals. Anyone that touches moms and babies, we work with them to see what we can do to help to improve birth outcomes.
So thank you so much, Janice, again, for being my guest on today's show and talking about such a timely and needed topic. We don't need a special month or a special situation to ever talk about how do we go about saving the lives of women, mothers and mothers to be, and their children and families as a whole. So thank you
Yes.
again for joining us and for educating the community as a whole.
Thank you so much for having me.
You're so welcome. Have you ever asked yourself the question, why do I have so much trouble sleeping? Do you suffer from stress, from jet lag, a health condition, or a medication that affects your sleep, mood, or concentration? Or maybe all three? Then you are not alone. In this week's episode of The Daily Drop, we'll discuss serenity and lavender. doTERRA Serenity is a restful blend that comes in both a soft gel and as an essential oil. The restful complex in the soft gel is a unique combination of lavender essential oil and natural plant extracts in a vegetarian soft gel capsule to help you get the refreshing sleep you need without leaving you feeling groggy or sleepy the next day. Experts recommend that the adults get at least 7 to 8 hours of sleep every night. Unfortunately, about 33% of Americans are not getting the recommended amount of sleep per night, and approximately 1 in every 5 adults in the U.S. experience occasional sleeplessness or difficulty sleeping. Depriving your body of sleep has been linked to many health risks and places a tremendous burden on virtually every organ in your body. Inadequate sleep affects our ability to lose weight or to maintain a healthy weight, influences how we feel, how we learn, how we behave. It negatively impacts our cardiovascular health and overall well-being. It also reduces our reaction time and interferes with our ability to drive. Getting adequate sleep is essential to recover physically and mentally from the demands of daily life. Quality sleep is vital to how you feel each and every day because it is essential to support your body's natural recuperative and restorative processes. For those that prefer not to take a pill, doTERRA also offers the Serenity Oil Restful Blend. This is a newly updated Serenity blend that has a calming and relaxing aroma that provides a unique user experience. This perfectly balanced, tranquil blend can be sensed immediately, transporting you into a state of bliss. Its benefits create a restful environment at bedtime, provides calming and a soothing aroma, and encourages a tranquil atmosphere. And like the soft gels, it also relieves occasional sleeplessness, promotes healthy relaxation, helps you to get a refreshing sleep you need without you feeling groggy or sleepy the next day. It also helps make a difference in the quality and the ease of going to sleep. It encourages restful sleep while calming the nervous system and reducing stress. And finally, lavender. Lavender is one of the most popular oils and is certainly known for its benefits of providing a calm and restful sleep, but also reducing stress. Overall, when in doubt, you may use any one of these three to help support you on your journey to a more restful sleep, reducing of the stress, and controlling of emotions and anxiety.
So if you'd like more information, please visit our website at www.drtiffanytaft.com and visit the Wellness Boutique. We'll be right back.
Want to appear on the Wellness Lounge with Dr. Tiffany Taft? Email the show at info@drtiffanytaft.com. Or you can hit us up on Facebook or Instagram at Dr. Tiffany Taft, or visit through our website at www.drtiffanytaft.com. And to view past shows, visit us on our YouTube channel at Dr. Tiffany Taft. Stay tuned and we'll be right back.
Thank you so much for visiting us at the Wellness Lounge. And remember, please like, share, comment, and follow on all social media platforms. You may visit our website at www.drtiffanytaft.com and follow us on YouTube at the Wellness Lounge with Dr. T, and of course on Facebook and Instagram at Dr. Tiffany Taft. And as always, be well and be informed.